Hi, my name is Jennifer Lawton. I'm the president of the Women in Thoracic Surgery, and this year we have the wonderful pleasure of celebrating 30 years of the Women in Thoracic Surgery. And so this roundtable discussion is to talk about the history of the WTS.
My name is Mara Antonoff. I'm a thoracic surgeon at MD Anderson Cancer Center in Houston, Texas.
I'm Jessica Donington. I'm a general thoracic surgeon at NYU in New York.
I'm Bill Baumgartner. I'm a former chief of cardiac surgery at Johns Hopkins and just recently completed time as the executive director on the board of thoracic surgery.
And I'm AJ Carpenter. I'm an adult cardiac surgeon at the University of Texas in San Antonio.
So AJ, you were the 5th president of the WTS, so you've seen the organization progress over time. What would you like to see in the next the next 30 years of our history?
Well, it's been a real period of growth for us since the time when I was president. I can remember being really excited in the year 2000 to go and meet the first 100 women who had been boarded in thoracic surgery, only to discover that there weren't 100. And now in just the last 15 years, we're approaching 300. So I think the biggest thing we've seen as an organization has been real growth in the number of women who endeavor to enter our profession as cardiac and thoracic surgeons, and I certainly hope to see that continue. In recent years, we've seen women from these organizations who have sat on the American Board of Thoracic Surgery, presided over the American Board of Thoracic Surgery, been members of the residency review committees, presidents of our major organizations, and I certainly hope that we'll continue to see this progress as we go forward.
So Jessica, you're the incoming president of the WTS, and about 4 years ago you wrote an article about the state of cardiothoracic surgery and women in our specialty. Do you think that there are specific barriers to entering our specialty for women?
I always think that some of the barriers for women entering this field is maybe just seeing themselves when they're medical students in the field. And I think some of that was borne out when I did the survey. That my article from 2012 was about, we surveyed the entire field. All 200 women who existed who had been boarded at that time were surveyed. And I learned a couple of important things. One, it's a really strong community. The response to the survey was huge. The response rate was much higher than we see in most profession-based surveys. And I think women were excited to tell their story and to share their story with others. And I think part of that importance of barrier in the field is mentorship. We really learned by asking women why they went into the field, what was important. That mentorship was a huge, huge part of it. And I think that ability to see yourself in this field is sometimes difficult for young women. And I think that's one of the important roles that the WTS plays, is showing young women that we're here, we're happy, we're successful, and that it's something that they should be able to see themselves doing.
Mm-hmm. Dr. Baumgartner, you were just the executive director of the ABTS, and we know that in 1948, the board began certifying surgeons, and the first woman was certified in 1961. And you also had the pleasure of speaking at the symposium at the 15th anniversary of the WTS. So what changes have you seen not only in the specialty, but also as the director?
Well, I think, Jennifer, I've seen tremendous progress on the part of women in thoracic surgery. And I hope one day we get to a point where women are not just classified as women in thoracic surgery. We have thoracic surgeons, and that is how I would love to see it in the next 30 years. But what I've seen in the board is that the percentage of women being certified over the last few decades has just gone up considerably. And in the 2015, 16% of the physicians who were certified were women. And that's an incredible achievement compared to what it was even a couple decades ago. So you all have made great strides, and I think it is due to mentorship. And it's due to mentorship, as AJ has pointed out before, by having both men mentors, but it's also having women mentors, because I think they need to see you that in fact you are successful, that you are leading a variety of things. AJ mentioned being leaders in the board. We've had now two recent people that have been board chairs, Carolyn Reed and Valerie Rush. And now we have Yolanda Colson on the board. And And Jennifer, you're the board representative to the RRC. So and AJ's the president of the Southern Thoracic. I mean, it just goes on and on. And that wasn't the case 10 years ago, was not the case.
Mm-hmm. And Mara, you have a unique perspective as being a new member of the WTS Leadership Board and also being recently trained. And how would you like to see the WTS change over the next 30 years?
That's a great question. You know, some of the things that I really enjoy about the WTS right now are that it serves a lot of functions for women in cardiothoracic surgery, providing mentorship, helping identify opportunities for women, and really making our career enjoyable in a lot of ways. But one of the things that we also aim to do is to find the best and brightest and try to keep them engaged when we look at trainees, trying to make sure that we keep this specialty attractive for them and find ways to encourage some of the best and brightest medical students and general surgery residents to come into our field. I'm hoping that 30 years from now, we don't have to put any efforts toward that goal. I hope that the best and brightest men and women want to enter our field and that there aren't so many obstacles that require us to spend time convincing the women to come into our field, and that rather we can spend most of our efforts making their careers successful and helping guide them on the paths that would really be best for our specialty overall.
Mm-hmm. So AJ, there's a famous quote, when you get to the top, send the escalator down. So I don't remember who said that, but many of us have had, the majority of our mentors were men because were not female mentors available. Do you see that changing in the next 30 years?
Oh, I think that, I hope it's not going to change from the standpoint of men being great mentors to us. Certainly, I came along at a time when there weren't many women ahead of me. There was Leslie Coleman and Carolyn Reed, who were great mentors to me, but there were also men who were very important to my success and my courage going through this. Dr. Baumgartner was one, Dr. Larry Cohn was another. I wouldn't be where I am today. And I well appreciate that means that it's my responsibility to reach back down that ladder and pull the next ones up. I hope that that both men and women will be great mentors to each other as we go along. I think it's as important for us to support the young men. My chief resident took some paternity leave this year. After giving maternity leave to one of our women, what other choice did we have? So I think mentorship is really important on all sides. And I think that as we mature as human beings and as we mature as a profession, it's only going to get better.
So Jessica, in terms of the different subspecialties in our field, do you think that there are barriers that women see these days to becoming one type of a surgeon as opposed to other types of surgeons? You touched on that a little bit in your article.
Yeah, so I definitely think as we watch women enter the field of cardiothoracic surgery that there is a preponderance of women in general thoracic surgery compared to adult cardiac or congenital. And you know, whether that's a perception of a better lifestyle, which I have to say the lifestyle for general thoracic surgeons once you're finished, it does have its benefits, or whether it was the mentorship. I don't know. I think there still is this very strong perception that the lifestyle in adult cardiac surgery or congenital may not fit with a family for women. I think it's a misconception, and I think all of our trainees now are looking for improved lifestyles. I don't think that's a gender-specific issue anymore at all, but I also think that all three of those specialties have improved lifestyles compared to where they were 10 or 15 years ago. But I do think that is a perceived difference. And also in general thoracic surgery, like I said, we had a few really key role models that were here for a very long time, and that I know many of us who have followed in those footsteps.
Mm-hmm. And Mara, you recently wrote an article that was published in the Annals of Thoracic Surgery summarizing the 30 years of the women in thoracic surgery. Do you think 30 years ago it would have been possible to have a child during fellowship?
I don't think it would have been possible to have a child during fellowship 30 years ago. I don't think it would have been possible to publish an article in the Annals of Thoracic Surgery 30 years ago about the experience of women in thoracic surgery. So I think it's remarkable how much things have changed in many ways. I don't know that 30 years ago we would have ever considered having a woman president of the Southern Thoracic. I think there are a lot of wonderful ways that things have changed, and it was terrific for me to learn through the writing of this article all of the many ways that our specialty has changed over the last 30 years, in part to the strides made by the women pioneers who came before us, but also because of the male advocates and the society's sponsorship of the women. It's really remarkable how much has changed, and I'm just really excited to see what will happen in the next 30 years.
Dr. Baumgartner, you've been a mentor to everyone at this table and many, many other people. Do you think that there are unique challenges to mentoring women?
No. It's pretty easy.
That's a good answer.
It's pretty easy. And I don't differentiate it. I don't see trainees or young faculty. I don't see women and I don't see men. I see just cardiothoracic surgeons, and it's just my daughter is a pediatrician, and you know, she's going to move into an office role. She's in general peds. She's going to be a leader. But I would never think that she couldn't be. It's really part of the evolution. I think I look back and there were, if you go back 40, 50 years ago, there are certain residency programs that wouldn't let you get married and participate, right? I mean, those are the kind of things that really talk about lifestyle or lack of it. So there's been, I mean, and that's maybe 50 years ago. That's not that long ago. So it is, but I think the trajectory of women coming into the field is to me exciting, and we have to, right? If we're going to do well as a specialty, we have 50% of our graduates from medical school as women, and not only are they women, but they're also some of the brightest and the best. And if we don't get those people to come in, we're going to miss out on a tremendous opportunity. And the long-term effect is our patients are not going to be taken care of as well as they should be. So I think I've seen just such a tremendous change among culture. It's a culture thing across our field that I see no reason that it won't continue.
Mm-hmm. You know, that's even more recent than 50 years ago. Your comment reminds me, as I was interviewing for a residency for general surgery before I chose to go into cardiac surgery, actually being told by a faculty member I interviewed with, who asked me if I was married, and then told me, well, if I came to this program, I wouldn't be when I was done. that was a...
How many years ago was that?
Weeks and weeks, but not 50.
I can say that I have found that male mentors who either have professional wives or professional daughters have been much better mentors over time. And one of the things that we have at the WTS is a traveling scholarship or award that's sponsored by Scanlon that provides a trip for a woman resident and a medical student to go to a place to spend time with a mentor who's a woman when she wouldn't normally have that opportunity. Hopefully in the next 30 years we won't have to have that scholarship, and we'll just be giving scholarships, and maybe we will evolve to a minority group, in large, inclusive of more people other than just women.
Yes.
Only a question of time. It'll come.
Yes. Well, you made an excellent point that 50% of women in medical school, and the same is for women obtaining PhDs, and we will miss out on a lot of that talent.
We sure will.
But I do hope an added benefit of maybe women coming into our field is that maybe we're not so macho as we were, because that whole concept of you shouldn't be married and you shouldn't be, you have to be here 1,000 hours a week to be successful was probably not good for our field in general, men or women, and that maybe, I don't want to use strong words like the feminization of the field, but the inclusion of more women may have taken some of that edge away from our field, making it more popular to everybody now.
I think that's right. I think that's right. The 80-hour work week, although it causes ripples among. I'm just talking about the first iteration of the 80-hour work week. I was very for it. I mean, I think we should, as program directors, as faculty, ought to be able to train our trainees in 80 hours worth during a week. We ought to be able to do that. We ought to be able to figure out how to manage it. It's all about time management, and I think, and it gives those kids a lifestyle which many of us did not have. I mean, and it's although I think most of us who went through it would say, you know, we'd do it again, just the way it was. But I think that's going forward that you really need a balance, and although we're close to it, I think pretty well, we still have some room to even make it better.
Well, I think these are changes our profession has to have because of generational issues. The generation that's training today just won't accept that.
Right.
And we saw that in a decline in applicants to cardiothoracic surgery all the way around 5, 6, 7 years ago. And as we have moderated our lifestyle issues to be more accommodating to the current generation, I think we're seeing the rise again and many of the best and brightest wanting to come and join us. And it's a wonderful profession. I would not do anything else, and I can't imagine when I'm going to stop. But it's really highly regarded and a special, special thing to be able to do.
You know, one of the interesting things that occurs to me when you talk about the feminization of the field, you know, I think about, even for me, you know, being a relatively recent graduate, I know that when I started out as an intern and a general surgery resident and moving through my fellowship, it was always very important to me to prove that I was not only just as good as the guys, but I needed to somehow work a little bit harder or prove that I could be seen just like them. And as I'm kind of coming into my own, I'm realizing that perhaps I don't need to be exactly like one of the guys and I don't need to blend in, but that maybe there are some aspects of being a woman or being a mother that make me a better physician in some ways, that we each bring different aspects of our personality, of our home lives, of who we are as a complete person that brings something special to the care of our patients. And so perhaps rather than trying to prove that I can pretend that I'm a man, that maybe there are some good things about me in every aspect, and there are wonderful elements about the female mentors that I have that I know that they bring to the table because of who they are as an entire person. And whether they're male, female, tall, short, you know, listen to Dave Matthews in the operating room, whatever it is about them, there's a variety of things that help make them fantastic surgeons.
That's excellent. Thank you.